The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome back to Meet the Doctor. My guest today is Dr. Stephanie Moss, who is a first-year psychiatry resident. She also has her own podcast called Life as a Patient Doctor, which we're going to find out much more about right now. Welcome to the podcast.
Thank you for having me.
Okay, Stephanie, Dr. Moss, what does a psychiatry resident do? What's your job look like right now?
Oh, yes. So I am currently at an FHCC, which is a federal health center, which takes care of individuals in the military as active duty, recruits, and veterans. So I take care of them in the inpatient unit. I take care of them when they come into the emergency room, and I take care of them individuals outpatient.
It's not part of the VA. It's separate from the VA.
So it's an additional part. So a VA just takes care of veterans, while an FHCC, Federal Healthcare Center, that's it, it takes care of also active duty and recruits. So I specifically work at the one that is on the Navy base or right off the Navy base, so all the Navy recruits.
So how often do you get those younger guys coming through for help?
All the time. That's actually the majority that I work with is the recruits or the individuals particularly that are trying to get out of the Navy because they are having significant mental health conditions that are preventing them from being able to complete boot camp. So that is actually my little niche that I work with, is a lot of the recruits that are leaving.
How do you help them? Are you the one who makes the decision about whether they get to stay or go?
We don't, since we are not military physicians, we're not the ones who make the final call. However, we're the ones that give the recommendations that they are not fit for duty and that they have pre-existing health conditions like PTSD, autism, bipolar, things that are aggravated by going through the boot camp. And that's usually why I see them, is because boot camp is so intensive. It brings about a lot of difficulties that they've had in their life. And a lot of times, a lot of these kids, I call them kids because they are literally 18, 19 years old. A lot of them have come from all over the country, and a lot of them do not receive mental health support. So this is usually the very first time they've ever seen a psychologist, a psychiatrist.
How do you go about making them feel safe enough to tell you what's really going on?
That is a complicated situation. I think a lot of it is my initial presence of safety and saying that I'm here to listen to them and listen to their story. And that really opens up everyone, no matter if they are young, middle, or old, no matter their age, no matter their trauma. That is actually one of my specialties, is individuals who've been through trauma and been through significant stressful experiences in their life. And we just want someone to listen. And same thing is just through validating their experience, their emotions, a lot of things come out and they are very happy to finally be heard and respected.
Do they ever decide they're okay and they're going to stay? I mean, do they find themselves trying to get out by the time they reach you, or are they trying to stay, or is it just all over the place?
So usually they've come straight from the base after they become suicidal. And so the majority of what happens is individuals, when they are told they are trapped and cannot get out, and that's what is told on the base, that once they sign a contract, they're obligated to complete their 4-year, 5-year, whatever they signed for it. And that's not true at all, but it's what they're told. And so they become suicidal. They feel that they would rather die than stay in the military environment. And so that's when they get sent to the emergency room. I get to talk with them, and then I get to explain to them there is a way out. And there is a set process. Hundreds of people are currently waiting to be let out. It takes only a couple of weeks. And so at that point, after I do my my evaluation, which can take up to an hour, to really understand what are their risk factors for having mental health conditions. Do they have an untreated, undiagnosed mental health condition? Have they been suicidal in the past? There's so many risk factors that I talk to them about, and then I make a determination of whether I will keep them in the inpatient unit um, for an additional further evaluation or until they end up separating, which can take anywhere from 4 to 6 weeks to separate from the military, or send them to another ship, what they call it, another building where they can just same thing, wait 4 to 6 weeks, but be back in the military environment, which is usually not very healthy for these individuals. And so the majority of time we do just keep them inpatient.
This sounds like really important work, and I had no idea that this was even
A thing.
available, right?
Right? I didn't either. I applied to this position, like, I went to medical school, I applied to residency all over the Chicago area, and even when I interviewed, I learned about the FHCC, but I didn't know or learn about the broad depth of our responsibilities until I was a first year. July 1st is when all the first year residents started, and I really got into learning all the additional
Yeah.
responsibilities that are definitely beyond a lot of other psychiatry residencies because this is the only one in the country that exists.
It's the only one in the
Yeah,
whole country.
because we're the only Navy facility. We're the only boot camp. And I think the Army, Air Force, and the other locations do not they have their own hospital, but no
Yeah.
other place has all three veterans, active duty, and recruits. So we're actually a very unique hospital and residency program.
So you said July. So you've been doing this job now since July of last year, so about 10
Yes,
months?
I'm about
Yeah.
to be a second year psychiatry resident. So
How
yes.
will your job change when you go into year 2?
I'm actually I've been voted to be a chief resident, so I will be a chief resident for medical student education and a chief resident for wellness. So I will keep doing what I'm doing, but now being a little bit more responsibilities to take care of the mental health and wellness of my co-residents, and also. I very much value teaching and I love teaching medical students. So I'm as one of the co-chiefs for medical student education is actually teaching the medical students as they come through our units how to talk to patients, how to help them develop that rapport and be able to connect with them so they can actually make a meaningful difference.
It looks like you're happy to be staying there.
Oh, yes.
Yes. And then, so after year 2, will your job change again? What does the path look like?
In second year, I it's very similar to first year, similar locations. There's since we are also on since we're a regular hospital, I will spend more time, more rotations, more months as a consult psychiatry liaison. So whenever they consult psychiatry in the ICU or internal medicine floors or anything like that, I'll be doing some rotations there. And actually, a really cool thing that I'm about to do is I'm about to work at for a couple months at Elgin, which is the hospital where they house the individuals who have been told by the courts that they are mentally insane, and so they're not able to go to trial or they're waiting to go to trial for mental health. So I'm very excited about that because that's another very unique experience.
That's also in Chicago or somewhere else?
Yeah, and it's
Yeah.
actually in Elgin. It's a
Oh,
city.
yes.
Yeah.
Right. I did see the Blues Brothers. I got you.
Oh, perfect. So, yeah, I'll be actually one of their residents or psychiatry residents that will be working with those individuals.
If you can articulate, if it's even possible, how it makes you feel to be able to help this patient base, I would love to hear more about that.
Mm. Oh, I I feel so honored, so humbled, so thankful to be the listening ear and to provide and to treat them like people. And because I feel like a lot of individuals, especially when they have mental health conditions, they are sometimes seen by society or other healthcare providers as not subhuman, to some extent, or just not given the same respect, and so I feel so honored to be there for those individuals and to actually make a meaningful difference to help them at wherever they are in their own life journey.
Did you ever think you'd end up in this? I mean,
No.
it's such a special category of
Mm,
the field you're in already.
right. Hmm. No. I I chose a degree in psychology as an undergrad. And because I was really interested in mental health, but then I went to medical school. I wasn't sure between psychology and medical school, and I ended up going medical school because I felt like there was more that I could do, more potential I had, and I'm so glad I did do medical school because understanding the body and the brain connection has been monumental to my understanding of mental health and how people do live their daily lives. And so now adding this additional viewpoint of in mental health and really seeing the connection between health conditions, mental health conditions, and individuals' day-to-day life is just so meaningful. And I feel like I'm able to have this broader understanding to see patients and understand and kind of connect it instead of solely being focused on one aspect of their life.
You mentioned wellness a couple times already. Is there a special passion that you have for general wellness in
Mm,
terms of psychiatric health? How do
yeah.
I make a smart question out of that?
No, I hear what you're saying, and yeah, um, think the personal journey on the just the journey on wellness has been really personal in that sense is I am a human. I am ju I was a human before medical school and before residency, and I continue to be, and it was until medical school that I actually got diagnosed with both mental and physical health chronic conditions, and so it provided I had to really learn how to take care of myself in the mix of my studies. And that also provided me this viewpoint of the healthcare system, of physicians and the healthcare providers that don't take the time to take care of their own health and wellness. And
Yeah.
so that I think that is definitely one of through my own individual struggles, not just with my health, that then worsened during my academic because of the increased amount of stress, the increased amount of responsibilities we had. My health got worse. And so by then learning how to be open about my own struggles, trying to break the stigma in medicine and showing why it's important that we take care of ourselves, and then sharing those stories both from my own experience and, like you mentioned, my podcast life as a patient doctor, sharing the experiences of other healthcare providers, other students that have and are currently struggling with their own health conditions or with their experience, and learning how to be both a healthcare provider and also a human that takes care of themselves. So yes, wellness is an important additional thing of mine.
How much can you share about your own health story?
Yes, of
Is that something
course.
you're open about?
I am very open about, definitely all over social media and my podcast. And so in medical school, I was when we had the sexual and reproductive block, we were reading about all these reproductive health conditions, and we start going over just what the normal and not normal or health conditions or disorders that individuals had. And I started to recognize a lot of things that I had grown up with thinking that they were normal, thinking that going to the bathroom was painful and that was normal. Having a period with a lot of pain, that's normal. Having sex with pain, that's normal. These were incorrect thoughts, but these were my general life experiences. And so then being in med school and learning that, wait, it's not normal and not okay to be in pain. That's actually a health condition. And so over then going seeking healthcare support and dealing with my own challenges of dealing with the healthcare system of not appreciating women and female pain. That is a whole nother story that I could go into, but eventually I did get diagnosed with endometriosis, which is cells that are supposed to be in the uterus and they are not in their uterus, so they are outside the body and cause pain during different cycles of the next natural hormones. During that diagnosis journey, there was also COVID, so add in an additional stress in everyone's life, including my own life, which led me to fail exams in school, led me to then having to take time off of school. So all these different challenges that, again, learning and actually appreciating not just my own experience of pain, but recognizing that there are things around me that are leading to me more in pain and more struggling. And so learning how I can then treat my mental health, my physical health, and also take care of managing my stress and managing as much as I can of what is in my control and what is not in my control.
And what inspired you to start your own podcast?
Mm. I feel the biggest thing was I was blogging about this experience. I was writing
Way
first
too
in
much
my
work.
journal.
Way
Yeah.
too much work.
Well, that's what I was writing my own experience in my
Yeah.
journal. And so it ended up through my journal, I started publishing some of my posts to let people know about this struggle because knowing that 1 in 10 females have experience from endometriosis. And so publishing, creating a website, so sharing my writings, getting my writings published. And then eventually I started talking to people and realizing that people don't have the time to sit and read. That's really what motivated me to be like, okay, I'm going to just read my blogs, read my writings, which then morphed into now sharing my journey in medical school and also sharing the other challenges that I have experienced and overcome and other healthcare providers, both as students and workers. I've been very lucky that I have found a lot of individuals that have been willing to share their stories on camera, off camera, and but at the end of the day, sharing their story, even if they're anonymous or are willing to go like me, that's been so meaningful to be able to listen to their stories and share them.
Well, I totally approve of podcasting as a way to talk to people,
I
especially
bet.
doctors and prospective patients both. I think
Hmm.
there's something uniquely special about this medium,
Yes,
and you and I share that for sure.
for sure.
What would you like patients to know about you if perhaps they are on their way in to see you and have not met you yet? What do you want them to know about that?
Mm. I think one of the things I like starting my conversations with patients or hoping that they have is just knowing that I'm a safe place for them to explore different things that maybe are taboo in society or experiences that they've had that cause them to experience different fears or different emotions. All that is okay and safe. I literally carry around tissues not just for myself, but not just for the patient, but also myself. Like just being that open door in the sense of that I'm not going to say that their experience doesn't matter, their experience isn't true. And so really just recognizing that I am a person that through my own lived experiences and working with others, I have a broader depth that maybe if they've worked with other healthcare providers or mental health providers where they felt maybe didn't appreciate trauma or didn't appreciate pain or chronic health conditions, I might be the person that might be able to understand a little bit more. And sometimes I do disclose, sometimes I don't. It really depends on the situation. But um, I don't hide away if I feel like it would benefit from the patient knowing that I share the same experience, because sometimes it is helpful to know that they are not alone and that there's an additional depth of knowing that I've also struggled, or your clinician has also struggled, and are and that wasn't the end. And I think a lot of the times, whether if it's going through trauma or having chronic health conditions, sometimes we think that it's the end, that we can't go above that. We can't be, in quotes, successful in life, or we won't be able to overcome it. And so sometimes I like sharing it with my patients to show that, hey, I made it as a doctor. That means that you can also overcome whatever challenge you have, or at least live with your condition and still achieve your dreams.
Well said. Thank you
Thank
for that. Okay. Your podcast is called Life as a Patient Doctor. I'll put the link in the show notes so it's easy to find and listen to and recommend and share with your friends. And where can we find you on Instagram?
Yeah, so I recently changed my Instagram name, like, literally a couple of days ago. I had always been Med Psych Moss everywhere. My website is still medpsychmoss.com, but I decided to actually start using my name. So I did Steph Moss MD, so STEPHMOSSMD. So we'll see. I just changed, what is it, my TikTok, my Instagram, to both of those. And then on YouTube, where my podcast is and a lot of my videos, it is Dr. Moss.
We'll make that easy to find too. Thank you so much, Dr. Moss. It was great getting to know you today.
Yes, thank you so much for having me and allowing me to share my story.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.